Everybody, I'm Dr. Dennis Mariano. This is Sabrina, and how many weeks pregnant are you now?
39.
39, so you got one more week left that you're due, right?
Yep, one more week.
Good. So what we're doing is we are trying to demonstrate to you the benefits of chiropractic care for women that are pregnant. And most people that are pregnant know that they need chiropractic care?
No.
Yeah. So
They
what
don't.
challenges do women that are pregnant have when it comes to, if they're not getting adjusted, what problems do they end up having?
A lot of back pain, pelvic pain, hip pain.
Yeah.
Literally all pain.
Yeah.
Can't sleep well.
Uh-huh.
Hard to get up. Hard to walk.
Okay.
Like literally,
Uh-huh.
like they say, it's a pregnancy symptom.
Yeah. Yeah.
But then when you get adjusted and you don't feel as much. Like sometimes I don't feel it all during the day.
Right, and that makes sense too, because when your spine is twisted, here we go, good example here. So when your spine is twisted this way, and then the messages from the nervous system that go to the muscles, you know, the leg muscles, the low back muscles. Keep in mind too that the uterus is a muscle. So when it comes to the pregnancy, if the nerve supply to the uterus is inappropriate because you have subluxation or misalignment, and then the uterus can't contract properly. So the delivery is going to be critical too, because the uterus, when it contracts normally from the top to the bottom. It's almost like massages the baby out, right? So when you have these misalignments in the spine, the messages aren't getting through, like getting a bad Wi-Fi signal. Then what happens then is that the uterus, instead of contracting normally, it'll clamp shut, right? And it'll jam the baby. Now you have increased heart rate, then the problem becomes like an emergency situation. It doesn't have to be that way. So the whole purpose of chiropractic care is to allow the nervous system to function better, so this way you can have a normal pregnancy. You're not supposed to be in pain. Make sense? And I know that you've done really well with that. So we're going to demonstrate now how we adjust and how safe it is. So we'll start on your back first, Sabrina, here. There you go. Okay. So we're going to be here. Let's check first. Push the leg out to the side and hold. Okay, she can't hold that out. Push outward to the right. Nothing there. This one here, push. And that one's stronger. So there's already an asymmetry. And we won't keep you on your back for too long because it's uncomfortable. Hold. And there's a problem up on the neck area. Take your index finger, touch right there. Elbow out to the side. And we're localizing where the problem is. Push out to the side again, hold. See how much stronger that is? Take your finger away again and hold, and it goes weak. So what's happening here is that the cervical spine, the occiput, is supposed to be on the level here, on the horizon. Her subluxation is like this, and it's throwing her off. So then the abduction, the abductor muscle can't do its job because it's trying to hold herself up, and that puts pressure on the whole nervous system. So we're going to then adjust occiput here, very gently, resetting it. We're going to check again, push out to the one side and resist. Still weak. Let's see where the problem is. Hold, hold, hold. And it's on the other side. So C1 is a counter rotation. Back to the middle. Check again. Push out and relax. There you go. Push out and hold. Much better. Good. Another thing we want to check is the whole rib cage could be twisted. Hold strong. Clockwise is fine, and counterclockwise is not. So your whole rib cage is like this. Is that good or no? Not good. Let's fix that. Bend your knees up so that not much pressure in the low back. Take a deep breath. Breathe all the way out. Again. And out. One more. Hold the arm up against the ground. Hold strong. And the diaphragm becomes compromised, and in this case it's only unilaterally. Clear that out. Hold the arm up again. Good. Better. And the pubic bone can be misaligned as well. And that's really critical because the pubic bone right here, there's actually a disc in the middle, and when that gets locked up or subluxated, it doesn't allow the pelvis to move, which affects the sacrum and the lumbar spine. It's a whole cascade of issues that become a problem. out to the side, stay there, and we're gonna have you squeeze together. And this is how we balance it, very gently. Keep going. Keep going. Good. Do the opposite now, Sabrina. Push outward. No strength at all.
No.
Push out. Right there. Push out. There you go. And push again. Beautiful. Good. Stay where you are. Hold the arm up again. And resist. Got it. There you go. Hold, hold. Better. Feet straight out one more time. Let's check the balance. Push out to the one side, hold. And the other side, hold. Beautiful. Okay, now, hold on. Take a hold of my shoulder, hold the breath, and come on out. Now, we're gonna check you in a sitting position. Chin down, hold, head back all the way. And that goes weak. See here. The laser. Head backwards again. Sideways. Turn this way. So these are myotones. These are the software component of the adjustment. Turn again to one side. Tilt sideways. Look straight ahead. Tilt the other side. And it goes weak. Tilt again. In middle. Hold strong. Hold. Hold again. Good. And then we now check subluxations. We have one at T5 which controls stomach. So you think it's important to adjust the stomach nerve? Because you don't want to get heartburn and all that, right?
Yeah, it makes sense now.
Hold. And adrenal glands and the liver nerve. Hold again. And T12, which controls the enteric nervous system, which is 80% of the immune function. Better. Left hip, subluxated. L5. That's much better. Beautiful. Good job. All right, so now, you stand up for a second now. The cool thing about this table, this is made for pregnant women. You collapse it all the way down and lift this piece up so that she can put her belly in there.
That's cool.
There you go. Got it. Okay. So we can check symmetry of the pelvis. And look at this here, Jeff. So you see the difference there? Go around this way, you can see the difference.
Mm-hmm.
You can see that?
Way off.
So that indicates that the pelvis is rotated this way, which is not good. So we can now use the instrument to balance the system. Bend both again. Still not. We're going to use the table as a drop here. And reset it. You okay?
Yeah.
Bend both again. And now you got the balance. Good. Bend this now. Hold strong. Hold again. And relax the incision. SI joints need to be balanced as well. Hold. L4 is rotated as well. Bend this again. Better. Hold. Good. Keep your knees straight and raise those legs straight up and down on the other side. See how that goes to the side there? Lift this again. And the other side. And Sabrina has that pattern from a while back. And the thing too is that when you have pregnancy, the relaxin hormones is coursing through the body, so there's a lot of looseness going on. The good news is after she gets, the delivery happens, she has 8 to 12 weeks of correction in her spine that can happen because the ligaments are still loose that men will never have. So that's a good opportunity for her to make corrections. And she already has that plan in place. Relaxing some of the glute muscles here, causing that hypertonicity because of the pelvis being out. Raise one leg at a time, and the other side still there. Lift again, and down. Yeah, still. So now the sacrum's rotated. Sacrum's rotated this way. We need to drop it. Lift against me, and the other side. It's better. All right, do a push-up for a minute now. All the way around. Good. So now, 5 in your stance, arms in front of you. Take a deep breath, just relax. Good. How's that feel?
Great.
More relaxed, right?
Yeah.
Hold. 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 Now we're adjusting her in a standing position because when your body is standing, the gravitational forces are different on the spine than when you're laying down or sitting down. There you go. Hold. Nope. Hold again. T1. Hold strong. And hold. There you go. Good. All right. Walk back and forth. See how the body feels there.
Feels great.
What's the difference?
Everything.
Yeah.
I don't have the pain here anymore.
Okay, you had pain there when you came in?
Yeah.
Okay.
Feeling great. It doesn't hurt.
Doesn't hurt. Okay.
Yeah.
Sounds
Doesn't
good.
hurt too. Now it doesn't hurt during the process either, so it's
Okay.
great. Yeah.
Well, that's good. Well, yeah, so we got one more week, you know. And again, keeping, and the nice thing about Duluth, so in our practice, when we have a woman that's a patient of ours, our gift to them for taking care of their nervous systems, when the baby's born, we will adjust that baby at our cost. So you can have that baby start their life subluxation free, and that's going to change the future generations.
It's amazing.
Right? So that's what's going to happen. The last thing we're going to do is called locomotor lock-in. We're going to lock everything in here. So everything that we just did in the nervous system changed her whole physiology. So we're going to have her march in place in the new pattern that she already has, and then put the laser on her spine. Go ahead, Masabrina. And the body's going to start memorizing the new pattern so it can hold that adjustment a lot better. And close your eyes. And you can stop now. Here we are. So that, folks, is our way of adjusting pregnancy, and it'll be nice for you to see this down the road when the baby's 5 years old.
Yes.
You can remind them what they look like before
Yeah.
they came out.
Yeah, that's true.
Yeah. Thanks for letting us
Thank
video.
you, of course. Thank
Yeah.
you for your help.
Of course.
You're great.
Enjoy the rest of the day.
You too.
Okay.
Thank
Take
you.
care.